Diabetic ketoacidosis is a serious and potentially life-threatening complication of diabetes, primarily seen in type 1 diabetes, but also possible in type 2 diabetes under certain conditions. DKA is typically caused by absolute or relative insulin deficiency that is accompanied by an increase in counter-regulatory hormones such as glucagon, cortisol, growth hormone, and epinephrine. Without insulin, the body begins to break down fats as an alternative energy source, leading to the production of ketones. The primary risk factors include type 1 diabetes. DKA can be the initial presentation of type 1 diabetes. Missing doses of insulin or not taking enough insulin. Infections can increase the body's need for insulin. Conditions such as a heart attack, pancreatitis, hyperthyroidism, or severe illness can trigger DKA. Children and young adults with diabetes are more susceptible. Drugs such as corticosteroids and diuretics can increase the risk. Physical or emotional stress can affect blood sugar levels. Excessive consumption of alcohol or use of certain drugs can lead to DKA. The symptoms of DKA can develop rapidly, often within 24 hours, and include high blood glucose levels above 250 milligrams per deciliters. Presence of ketones in the urine or blood. Frequent urination due to high blood sugar levels. Extreme thirst due to dehydration caused by frequent urination. Nausea and vomiting often accompanied by abdominal pain. Generalized body weakness and lethargy. Fruity scented breath due to acetone, a type of ketone. Altered mental status, ranging from confusion to coma. Kussmaul respiration, which is deep and labored breathing. The diagnosis of DKA involves several tests and clinical evaluations. Blood glucose test to check for elevated blood sugar levels. Measuring ketone levels in the urine or blood. Arterial blood gas analysis to assess the severity of acidosis. Electrolyte tests to check for imbalances, especially of potassium. Complete blood count to detect any underlying infections. Electrocardiogram to monitor heart activity and detect potential complications. The treatment of DKA is aimed at correcting the metabolic abnormalities and addressing the underlying cause. Initially, within the first hour, ensure airway patency if unconscious. Monitor oxygen saturation and provide oxygen if needed. Insert a large bore intravenous cannula. For fluid replacement, an initial fluid bolus of 0.9% normal saline 1 liter over 1 hour is given. If shock is present, 20 milliliters per kilogram bolus over 15 to 30 minutes should be administered. After initial bolus, infuse 0.9% normal saline at 500 milliliters per hour for the next 4 hours. Monitor hemodynamics and adjust rate based on hydration status. For correction of hyperglycemia, intravenous regular insulin infusion at a rate of 0.1 units per kilogram per hour is administered. Avoid bolus insulin unless patient is in severe acidosis. Continue insulin infusion until ketones are cleared and anion gap is closed. Aim for a decrease of 3 to 5.5 millimoles per liter per hour. If glucose falls below 13.9 millimoles per liter, switch intravenous fluids to 5% dextrose in 0.45% saline to prevent hypoglycemia. Monitor serum potassium frequently every 2 to 4 hours. Start potassium chloride 20 to 40 millimoles per liter in intravenous fluids, once potassium levels are between 3.3 and 5.2 millimoles per liter. If potassium is less than 3.3 millimoles per liter, hold insulin and give 40 millimoles potassium chloride per hour until potassium is more than 3.3 millimoles per liter. There is a criterion for stopping intravenous insulin and transitioning to subcutaneous insulin, and that is when there is resolution of DKA. pH of greater than 7.3, bicarbonate of more than 18 millimoles per liter, and a normal anion gap. When they are able to tolerate oral intake, administer long-acting subcutaneous insulin 2 to 4 hours before stopping intravenous insulin. If not treated promptly and effectively, DKA can lead to serious complications, including cerebral edema, hypoglycemia, hypokalemia, which can cause cardiac arrhythmias, acute respiratory distress syndrome, kidney failure due to severe dehydration and shock. Preventing DKA involves several strategies to manage diabetes effectively, including keeping track of blood sugar levels frequently, ensuring that insulin is taken as prescribed, understanding the signs and symptoms of high blood sugar and ketones, maintaining a balanced diet, regular exercise, and avoiding triggers like alcohol and drugs. If you found this video helpful, don't forget to like, share, and subscribe for more informative content. Stay tuned for our next video.